Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hello, everybody, and welcome to Healing Families Shattered by Addiction. Today, Brian and I are going to talk about how addiction affects the family. We're going to go into a little bit of the description of what that looks like to people, and then I'm going to turn it over to Dr. Brian Jackson, my little fellow friend, and he's going to talk about the actual disease of addiction and the addiction cycle. And I think the next step will be to give you some ways that we can heal. So we're really excited about today's topic. I think it's something that will be very helpful and useful to family members. And let's start by, just talking about that. Like, how does it affect and why do we call it the family disease? So when you're part of a family, each person has their own role within the family. And when someone has addictions, it affects people in a direct or indirect way. So, when we have those kinds of things, everybody begins to have a negative impact on what's going on in our family system. And then it begins to start to stress people out. The anxiety levels can go through the hoop. Sometimes we go as far as getting really hopeless and depressed. And, we can be isolated. The shame begins to creep in. We start to see actual physical health issues that can result from focusing intensely on this person rather than yourself, right? So, we have to look at that. Some people go extreme, right, where they get into risky sexual behaviors and promiscuity to try and bring the person back in. And then, in turn, it becomes a lot of anger and resentment. When we are consistently in this persistent stress mode, we start to take on some interesting patterns of dysfunctional behavior to cope and compensate for how we are in so much pain and the stress that this is causing. Things like codependent behaviors, role reversals and distorted roles, emotional disconnection, attachment and disorders and attachment issues for children is a definite consequence of the disease of substance abuse. So when I'm talking about codependent behavior, I'm talking about things like characteristics such as denial. We go into low self-esteem, controlling, and we avoid. We love to do that primal defense mechanism, which we call denial. And we would become very compliant. These are coping mechanisms that we try to, because everything is so confusing and the tension is so strong and there's such unpredictable behaviors that we tend to try to compensate for all these issues that are going on. And the family can become very enmeshed, right? Which means poor boundaries, and we don't know really like whose role is what and that kind of thing. So when I'm talking about, emotional disconnection, that makes sense too, right? When I'm getting more and more concerned about how to manage this disease, I start to withdraw. I might yell, scream, cajole, criticize. I don't understand what's happening. And when we're in that negative space, right, we start to pull away from one another, and there is this huge emotional disconnection. And, attachment disorders are not uncommon for children if they are, starting off in their lives with a parent that is using and abusing. And let's say, for instance, it's dad, and mom is focused so strongly on what dad needs and how to control this behavior and keep it under wraps, because of course there's so much shame involved, that she begins to not pay attention to the children. And therefore the main caregiver that those children need is disconnected, and there's, resulting in things like attachment disorders. Interestingly enough, this can get so intense and it can go on for a very long time that the health repercussions from, being under that constant emotional, mental, and physical stress, can cause things like cognitive impairment. Believe it or not, the family ends up sometimes more impaired than the person actually at times. For children, there's some developmental delay sometimes because they're so stressed out that they're not able to pay attention, and other things that are going on inside of their brain. Heart disease, diabetes, of course, depression and anxiety is a definite fallout from this. And sometimes, believe it or not, substance abuse itself, because they don't know what else to do, they finally end up using themselves, which is, a very sad situation. When we think about the disease of family addiction, now I was thinking about, the distrust that goes along with it, right? We start to really get angry. We distrust what's happening. We never believe them because they're lying anyway. I always remember, like with my ex-husband, for sure, he'd say he'd be home in an hour, and it'd be 4 days before I'd see him again. And obviously there was some discontent that would go on there. So pretty soon you don't believe anything that they're saying. You don't know where they are. You're in a constant state of stress and distress. And it just becomes this convoluted mess and not really understanding, which leads into that role reversal that we were kind of mentioning before, right? Which is someone else takes over the role of. So like in my case, we had a business together, and I ended up taking over the business, running that show. And, in theory, it's kind of funny, but it's not. You're like, where are they? I don't know what to do, but you're so hell-bent on keeping everything together because you can't let the world know that there's actual problems behind the scenes, right? That would be just something that no one could understand, right? Nobody else gets this whole thing. And you definitely feel like you're on an island all by yourself. So I think it's really important that you understand that you're not in this alone, that there's many of us that have experienced this, and together we can. But I think it would help to first understand, what exactly is going on with the disease of addiction itself and get a defined definition of what that looks like. So, Dr. B, my buddy here, soulmate in crime, could you bring us up to date on what that looks like?
Yeah, Di, thank you. And wow, that's a long list of how this addiction can affect the entire family. And I think the frustrating thing for family members is trying to separate the person from the disease. And I really would like to address the disease because it looks so confusing to family members. Like, why do they continue to drink? Why do they continue to do drugs? You might have a family member that has hypertension, and that disease does not disrupt the family like addiction disrupts the family. The addict and the alcoholic, all the statistics show that we are above average intelligence, above average wage earners. So not stupid people. And you look at them and say, why don't they just stop? You almost lost your job. You almost lost your life, yet you continue to drink or to do drugs. But some people have this disease. It's like the diabetic who metabolizes sugar differently than a person who doesn't metabolize sugar the same way. The addict and the alcoholic who truly have the genetic predisposition to this illness, just like any other illness, like when you go to the doctor's office, they may ask you for a family history. Is there heart disease? Is there stroke in the family? They're trying to see if there's, a propensity for you to potentially, succumb to or be affected by that illness. Rarely do they ask you about addiction in your family. So, a lot of times when we interview people, we do what's called a biopsychosocial evaluation, we will inquire about the paternal side of the family, the maternal side of the family. And it doesn't necessarily have to go straight up the line. It doesn't have to be the father or the mother, but it could be the grandfather, grandmother, aunts, uncles. And some people inherit this gene but never display the behavior. In my case, I have two sisters. I'm in my 23rd year of recovery from alcohol. And neither one of them have any interest in drinking alcohol. So, you might have the gene, you might not display the behavior, but that has a lot to do with how the alcoholic or addict metabolizes the alcohol or drugs. And it's very, very difficult to just stop. You start to build up a tolerance, and the next thing you know, they're addicted. Whereas somebody else who doesn't have that genetic predisposition, who doesn't metabolize the alcohol or drugs like the alcoholic or addict does, doesn't show any of those signs or symptoms. And so, when I went to Betty Ford and they said to me, you're an alcoholic. And I was like, yeah, okay, well, that's your opinion. You're the counselor. But I was always like, prove it to me, prove it to me that I do have this disease. And lately, there's being so much research done about this disease. And there's so much scientific proof that this is, in fact, a brain disease. And when I say a brain disease, it's not like you're impaired, but it's the mechanism that's triggered in the brain once you ingest the alcohol or drugs. I mean, the dopamine release, the goodie that you get from it, how the serotonin receptors that control our mood are affected. And in the beginning, it might be fun, and then after a while, as it gets more and more intense, it's no longer fun. And the person gets to the point where they're not getting the same desired euphoria from it, but yet they are physically addicted. And so therefore they continue to use just to maintain. So there was a lady in Houston, Texas that was going to do research on brain cancer. So she rode with the Houston Police Department to pick up the bodies of winos and alcoholics that unfortunately had passed away. So she had brain tissue to do her cancer research. But as she started sectioning these alcoholics' brains, she found large amounts of tetrahydroisoquinone. I like to call it THIQ because I do not know how to spell tetrahydroisoquinone. And she said, this makes no sense. These people didn't shoot heroin. They didn't take opioid pills. Why do these alcoholics have this main ingredient of heroin, tetrahydroisoquinone, in their brains? So she started to do the research and took the poor little rats and put them in a cage and introduced them to vodka and water. They wanted nothing to do with the vodka, and she injected them with the THIQ, and they ended up drinking themselves to death. Then they took the next closest thing to us, which is a male adult ape, did the same thing, injected him with a specific amount of the THIQ, did not let him drink himself to death. And when they removed him from the cage and he passed away from natural causes, they then sectioned his brain and found the same amount of tetrahydroisoquinone in his brain. And it had not dissipated at all. So then people with 20 and 30 years of documented sobriety donated their bodies to science. They found large amounts of THIQ in the alcoholic's brain who had been in recovery, who had been abstinent for 20 years. So what happens is, my experience is not 95% of the time, 90% of the time, 100% of the time, the person who does have this illness, when they return to drinking, they always, within a short period of time, return to the level that they were drinking at or more. And why is that? Because with each drink they take, they are creating more tetrahydroisoquinone, which is retained in their brain. So, the relapses, in spite of the fact that they want to stop, and maybe they have the delusion that they can have one or two when they were a 10 to 12 drink drinker, it tickles the funny bone of that, if you will. And the next thing you know, they're off to the races. And we talk about it, alcoholism being cunning, baffling, and powerful. And I think the baffling part of it for the alcoholic is, how did this happen? I wanted to stop. I had the resolve to stop. But yet I'm back drinking as much as I used to. And that has everything to do with the way the alcoholic and addict metabolizes their drug of choice. There's been further studies where now we can do MRIs and peek inside the brain. And so we have the adult rational side of the brain, and then we have the impulse side of the brain. And so say you were thinking about buying a car. Maybe I'll get a minivan, it'd be good for the family, or maybe I'll get a sports car, so it'll look cool. Maybe I'll get a red one, a green one, a blue one. And the adult rational side, the impulse side of the brain are communicating, and then you finally make a decision and you go and you buy the car. The analogy is, the alcoholic says, I think I'm going to buy a car. And then they come back up and say, I bought a car. And what car did you buy? Well, I walked downstairs and there's one that said car for sale. And impulsively, they bought the car. And I'm not being, glib about it or trying to be funny, but that's what happens inside the brain. So with these MRIs, we peeked inside the brain and we put a person into an MRI and expose them with little snippets of, say, a bar, a glass of scotch, the sound of ice cubes in a bar. And the brain just lights up. And when I say the brain lights up, the impulse side of the brain lights up, and it's go, 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 in spite of the fact that they have every intention of not drinking. So it is cunning, and for family members watching this, it is so frustrating. Why can't they stop? Well, it's a disease, and the ingestion of the drug of choice leads to euphoria, and the tolerance level goes up, and they need more and more to get that same desired effect. And once they stop drinking, there's withdrawals that are associated with that. And those withdrawals can be so miserable, in spite of the fact that you want to stop drinking, that you can return to drinking. So anyway, the good news is this is a disease that you can keep in remission, as opposed to a lot of other diseases. I mean, God forbid you get cancer, it goes into remission, and through no fault of your own, it comes back. But there are so many tools and techniques out there and suggestions made by counselors like Di or myself that the alcoholic or addict can apply to their lives and put some time and distance from their last drink or drug and get involved in a program where they're around other people that they feel like they're not unique anymore, that they're not alone. And as time goes by, their life gets exponentially better. So through their efforts, they can keep this disease in remission. And that's the exciting thing about recovery. There is a solution. Is this a progressive terminal disease? Yes. Can you keep it in remission? Yes. And so, you're powerless over the alcohol, but you're not powerless over choice. And there's just so many good resources out there to help you get well. And I'm talking about the alcoholic or the addict. But there's also great resources out there for family members because, again, the disease makes you sick. And I think, Di, you were going to touch on some of the things that that people can do, and some of the improvement that can happen in their lives in spite of whether a loved one gets sober or doesn't get sober. And it's just so important that your happiness is not contingent upon your loved one getting sober. Life continues to go on. And I think that, as family members, you can get stuck in the rut and accept that this is what's going to be your life going forward.
Yeah, Brian, that was great explanation, and I think it helps most people understand when they start to break it down and can really hear that no one chooses to be an alcoholic or an addict. It comes, and yes, there are predispositions to those types of things, but I don't think there's anybody that wakes up or decides at, age 12 or 13 or 14, hey, my life's ambition is to become an alcoholic addict and really screw my family up. That would be great, but it is hard. The family, it's by the time they usually start to begin to understand what's actually happening, there is so much damage that has been done that we need to kind of be able to let them know there's a tremendous amount of hope. And the hope is there's many, many ways that the family can heal. And I'm just going to list a few things that, to start off and help people sort of begin to understand. And mostly it's, that you yourselves, the family members, can attend family therapy or counseling, hopefully with the addict or alcoholic, but even without them. There's things like Al-Anon. There's family counselors like myself and Brian. There's family and addiction experts right here, that there is a wonderful 3-month program that we've put together to help families understand and work through these problems. But many things are more important as well, right? Like, first of all, just as we just described to you, you're learning a little bit about the disease. And I think it's really, really important that one of our healing tools is to be able to learn as much as possible, not obsessively, but to learn and gather information about what this disease is and what it does and how you can help yourself. Learning how to set boundaries and realistic expectations is huge. And that is usually the scary one, for people to walk through and actually set a boundary and mean it. I can think of a few myself when I, absolutely terrified, right? Because the end result is they may not do what we want. And that means I actually have to follow through with what I said I was going to do. Because the worst thing we could do is set a boundary and then cave. So that's a really important one. So sometimes it means starting off slow and building on it. Like, for instance, maybe I'm taking the car keys, right? And you're not allowed to drive if you've been drinking. That's a boundary that I'm setting. So little things like that begin to happen, and, it also helps click in the brain of the alcoholic or addict that, hey, there's something happening here. And they're not yelling at me anymore. They're just doing something that makes them feel safe and keeps everybody out on the streets safe as well. Staying healthy yourself, really, really important, right? Because by the time we usually get to the place of learning that we have a serious problem, oftentimes the family member's health has declined dramatically. Stress can cause a lot of disorders. For instance, high blood pressure, heart disease, actually diabetes. They've even shown that cancer can be part of those things. Anxiety disorders, all kinds of things, right? Ulcers, I can't eat, I can't sleep, etc. So those are really important things. Trying to have a positive attitude, because usually, the family can get pretty darn negative, and understandably so, but it's usually for, the lack of understanding. When someone begins to understand and brings their own power back to themselves, it's really much easier to stay positive. But you have to be taught, right? Like, we have to learn tools and techniques, and we have to change the way that we think. So, there's a cause and effect that happens in every relationship with an addict and alcoholic. So oftentimes what we think we're saying and doing as being helpful is actually hindering, and it starts a cycle, or what I call the dance, right? So we want to help you learn how to change some dance steps. Getting enough sleep. Oh, huge, right? If we're tired and we are, not in our best place, obviously our emotions become heightened, our responses become less thought out, and we're much more reactive. We're not thinking clearly, etc. So it's very important to get enough sleep. And lastly, I suggest, the family therapy is one thing, but I also suggest strongly, and Brian and I are big believers in this conviction, is that to get some sort of coaching or therapy is really, really for yourself alone, right? So that you can kind of digest what's going on and dissect what you need for you and what tools and techniques are going to be applicable for you. Because each person is slightly different, and there's lots of tools and techniques out there. And I have to understand and get to know me. So when I know me, I can figure out which one of those tools and techniques is going to be a favorable one in my bailiwick, right? So, and you may have 6 family members and each one of them like different things. There may be some crossover, but there may not be. So we have to learn ourselves first and then understand how this is going to apply in the whole scenario of the disease of addiction. So, that's a beginning for all of us. I hope this was helpful. We don't want to overwhelm you too much because too much information can be just a lot to digest. And, Brian, do you have anything to say in closing?
Yeah, I just think it's so important to remember that, your loved one is not a bad person trying to become a good person. And again, trying to distinguish who the person is from the illness. Is the illness bad? Yeah, it's bad. We do some bad things while we're under the influence. However, as Di said, it affects the whole family, but there is hope that everybody can get better, and these outward signs of an inward change only come from speaking to someone who understands it. And I think, family and addiction experts, what we try and do is, look at your family dynamic and say, hey, this is what we think that we can work with, and this is a program that we think will help you a lot. So, our goal here is for you to get well and stay well. And we also want the alcoholic or addict to get well and stay well. That's, our goal. That's what we want. We've seen it over and over again, and it's just fantastic to see the transformation from where you are right now to where you can be and stay there. So again, go to our website, familyandaddictionexperts.com. There's some information on there about Di and myself and about our programs. Or you can send us an email at info@familyandaddictionexperts.com. You might have questions about this podcast. You might have other questions, and we'd be happy to answer those for you. So again, that's info@familyandaddictionexperts.com. We would love to hear from you. And
hey, we'll see you in a couple weeks, guys. We really appreciate you listening, and we hope this was beneficial.
Thank you.
Ciao. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.